Hi, I'm Dr. Kivett from Santa Rosa, California, and among other fields, I'm board certified in plastic surgery and dermatology. And I've had extensive experience with upper and lower extremities and have had a fellowship in hand surgery with two plastic surgeons who are one inclined in orthopedic surgery, the other in plastic surgery. Um, and they focus their practices mostly on the upper extremities. I'd like to speak today with you about chronic wounds on any body part, really, with reference to the extremities particularly, but this applies to all sites. We have arterial-caused ulcers, in other words, the arteries which bring the blood full of oxygen from the heart into the tissues. And then there are ulcers that come from the blood coming from the vein system, which is the blood that is exhausted of its oxygen, now returning to the heart. And there's differences and similarities in this situation. Um, Arterial blood flow requires at least 22 millimeters of mercury, which is akin to just barely pushing on the skin and watching it blanch when you take your finger off. That's not a lot of pressure. But if you are a patient who's ill and bad and not being turned, or if you've lost sensation to tell you that you've kept the blood out of a particular patch of skin on your butt for over a couple of hours, then that skin is going to break down because it's lost the oxygen. The peripheral arterial disease, PAD, is a blood vessel issue related to small blood vessels from either arteriosclerotic vascular disease, seen in elderly people, seen in smokers, seen in those with diabetes. And so what's seen there is on the legs, for example, thin skin, not much hair, not many pulses that you can feel. And when you elevate the leg, it actually becomes pale because the blood is simply not getting into those capillaries that are just underneath the outer layer of the skin that gives us that pinkish, oxygen-imbued color to our skin. Patients with this problem also get night cramps, especially in the foot. They have edema, swelling of the tissues in the legs. They have an issue called claudication, which means as you mount stairs, you get more and more pain in your calf muscles because the blood is not getting to your muscle, much less to your skin. This is studied with what's called TCO2 studies, meaning a pulse oximeter is used to check the blood content in the skin. And so this is what you see when people have the little clothespin on their fingers in the hospital, and you hear a beep in the background, and you see a number like 92 or 94 or 88 on the little monitor showing the percentage of oxygen in your blood, which should be up around 94 or higher. There's also a measurement called ABI, ankle brachial index, meaning ankle arm index, which is a measure of your blood pressure being checked at your ankle and then at your arm to see if there's a huge difference. Because if there is, then it means the blood is just not getting into the area where you are interested in studying, especially the lower extremity. Different ways to treat the problem are what's called revascularization, meaning put a stent into an area, clean out a blood vessel that's been clogged, lessen the blood sugar with some important diets that's described in other videos here. Sometimes an amputation is needed for an area that is just showing no real ability to survive. Also, other supportive elements like protein, vitamin C in relatively high doses, zinc, and probiotics, which are germs that you purposely take to help rekindle the correct concentration of bacteria, funguses, and yeasts in your GI tract, which are 100 trillion in number, are all ways you can help yourself. Now, as far as ulcers that come from a vein problem, about 1 in 800 Americans have leg ulcers, or about 3.2 million. And 80% of the time that originates right in the veins. So veins are the vessels that collect the used up blood once the oxygen has been used up from having received the oxygen-rich blood from your heart originally. And the veins then carry that back to the heart where it can get more oxygen. So veins can be shallow, like right at the top of your skin, or can be deep, further down, and at least two separate layers. And then to connect those areas are called perforators that allow there to be a complete network intercommunication between the various layers. So think about it for a minute. You have a heart in your chest that will pump uphill to get blood to your brain, and pump outward to get blood to your arm, and pump downward to get blood to all the places internally, like your kidneys, as well as externally, like your toes. And so you don't have a heart, however, in your feet to get the blood from your feet back to your heart. So think of the Panama Canal for a minute. The Panama Canal raises ships up higher and higher by system of locks until they go back down to the other ocean on the other side. And so your veins have one-way valves, which if you look at them sideways, they're shaped like this, and they're only allowed to be one direction from the feet up to the heart. So every time you take a step and your calf muscle contracts, what happens is it pushes in like this, and that opens the valves, and the blood comes up. And then once the muscle relaxes, the blood gets caught by the fact that these valves hold the blood up. So each layer of vein has this pumping action, and the blood doesn't go back down. Or at least it's supposed to not go back down. The problem is that sometimes if you have dilated veins from a uterus sitting on veins and dilating those veins and they don't go back to their original diameter, then you'll have a permanent tendency, and to a small or a great degree, to have the blood go back to where the valves are a little leaky so that the blood goes back down in there again. You can have a history of infections in your veins. You can be on your feet for 24 to 36 hours at a time, and so things kind of break down a little bit. But your gastrocnemius muscle is your pump, and that's the calf muscle all the way in the back. And so that's the one that's squeezing those veins to have the blood go up, up, up. Now, if the veins are leaky, then what happens is that the tissues stretch out because the blood will go out of the small holes that we all have in our veins. And so that blood will be deposited as iron in the tissues called hemosiderin. And so it looks like brown pigment or brown stains, and that's because the iron, which is comprises the majority of your blood, gets stuck in the deeper tissues with leaving you then brown changes on a permanent basis. If the tissues get swollen enough, because the veins have leaked enough water and in fact end up holding the blood behind, then you can get stretching and dermatitis, or a rash of the skin of that area called stasis dermatitis. So if you have a problem with it, you should go see somebody, let them evaluate the area with an ultrasound, which is a pain-free, not very expensive test that checks the vein drainage out of your leg back up toward your heart to see if you're deficient in some way, either a small way up at the hip or a bigger area of the vein valve down below. Regardless, many times the vein valve can be repaired under local anesthesia by your vein specialist. You should always, in this situation, elevate the legs as much as possible. Put firm compressing stockings on as soon as you wake up in the morning, before you put your foot down, and get rid of and lose all the advantage of having been in bed for 6 to 8 hours, laying flat to distribute the blood throughout your body. If you put those stockings on literally while you're laying on your back, before you actually put your legs down, that's going to be so much better for you. Losing weight, keeping your sugars down, protein intake up is very valuable. Getting massages of the legs from the feet up toward the heart help. Sometimes split thickness skin grafts help if you've broken down the tissue enough to get ulcers. And then if you can imagine the nutrition that you need as described above for the arterial ulcers, it's the same for the veins. So if you know someone with a similar problem, or if you'd like to share with your friends and neighbors, please feel free. Please give us a thumbs up, leave a question or comment, and as always, please consider subscribing so that we can continue to provide educational information on all of these issues. Thanks for listening.